Before I begin, note that there will be images of TSW skin in this video, which may be very graphic. So hi, my name is Michael. I have suffered from topical steroid withdrawal for the past 8 years. And these are some images of how I looked throughout my past 8 years of TSW. As you can see, I've improved a lot right now. So I'm going to create a series of videos to share my knowledge and my understanding of topical steroid withdrawal. And in the end, I'm going to compile all of these videos into either one comprehensive video or just a series of videos. Because there's so many topics to cover, I won't be making these videos in any specific order. And please note that I'm not a health professional. None of the content in my video is health advice. So the information I'm going to share comes from my 8 years of dealing with the issue myself and reading through hundreds of related medical papers, learning from the knowledge of doctors who specialize in treating TSW, and also from reading the hundreds of cases shared by other sufferers and learning from their experiences. So this specific video will be an introductory video about TSW. I'll be explaining what it is. I'll tell you a general case of how a lot of patients often get TSW in the first place, and then I'll explain the mechanism of TSW. I will also include timestamps, so feel free to skip around this video. So what is topical steroid withdrawal? Topical steroid withdrawal, also known as TSW, is basically this very uncomfortable chronic skin condition resulting from the use of topical steroids. It includes damage to the skin, specifically your collagen, and the slowing down of collagen production. There's damage to your blood vessels as well as damage to your nerves. It's not really recognized by mainstream Western medicine, despite the general consensus that topical steroids can have these damaging effects. They never go deeper than a general acknowledgement. So chances are, your doctor or your dermatologist will probably just say that it's a case of serious eczema or worsening eczema. You need more steroids, you need immunosuppressants. That's usually how they try to deal with it. And I went through many years of seeing various doctors from different countries, and they have no idea what TSW is. And they also have zero ability to improve this condition. So that's a major reason why I'm making this video series, to hopefully help some of you guys out there. Some will say it only happens from improper use of topical steroids. Some say it only happens when you don't follow your doctor's directions. But from reading the many sources and medical studies and the cases out there, it doesn't seem very accurate at times. So one defining factor is that the symptoms from TSW usually ends up being drastically worse than the eczema or the rash or the inflammation you had before you started the steroid treatment. And as time goes by, maybe after many months or a few years, when your TSW resolves, you go back to your condition that you had initially before the steroid treatment. You realize that the underlying condition was very, very mild compared to the symptoms from TSW. So the common symptoms. Here I'm going to show you some images I found on Google as well. So you have bright red burning skin. Sometimes we call this red sleeve syndrome. And you also have, a lot of times it spreads from a small area into more areas, or sometimes even full body. You have a lot of flaking. So the skin turns really hard and dry. And then at some point, it'll flake off in small flakes. And it just goes everywhere. It just flakes, like it gets stuck in your hair. It goes on your shirt. It looks like you have dandruff, except it's like not only your scalp, but your whole, like wherever you have the rashes, the symptoms. And a lot of times we have weeping. So there's liquid coming out of your wounds or just your skin in general. There's peeling. There's the skin feels very thin at times. It's hard to describe until you actually experience it, but it feels like not only is it very thin, but it gets damaged very easily. You get wounds get a lot of cuts basically, and they don't heal quickly. It feels like there's a delay in wound healing. And like I said, at times you're gonna have rock hard skin. Sometimes it feels like a shell. It's very, very painful. Sometimes it feels like it's like sandpaper that's just stuck on your body. And in many cases, we also become extremely sensitive to everything. This includes water. So when you shower, you might feel like it burns. You become very sensitive to lotions and oils that are supposed to make you feel better. They end up making the skin burn, makes it more uncomfortable. And I've even had times where even like a breeze feels like it hurts on my skin, or like air conditioning, when it touches my skin, it's very painful. Wrinkles are a very common symptom. When the steroids, they damage the collagen, you get wrinkles. It's just like when people get in the sun a lot, the sun damages the collagen, you get wrinkles. And we have this thing in TSW called elephant skin, and that's usually like very extreme wrinkles. It looks like I had this thing on my knee where after I used some stronger topical steroids from my dermatologist for I think just a few weeks, I didn't have any wrinkles on my knees before, but afterwards I had these really deep wrinkles and the skin looked like it was melting off of my knee. It was like drooping off of my knee. So that's elephant skin. And you would also have very high IgE. IgE is basically this measure of how allergic your body is. And when you usually take an IgE test, the normal range goes from 0 to 13. So 0 means very healthy, no allergy issues, no reactions right now. But 13 is very high, it means you're very allergic. But for TSW patients, we often have numbers in the hundreds, 200, 400, like these kind of numbers, like more than 10 times higher than their upper range. So yeah, that's common. And then people report that when their TSW flare dies down, their IgE goes back to normal. So yeah, and often we become very allergic to a lot of foods, maybe animal fur, just a lot of things, like both on the skin and things that we eat. We become allergic to these things during TSW. But these people also report that these things often go away when TSW is over. You often get itching pain. So first of all, the itch is quite different from normally when you have hives or you have a rash. The itch feels like it's on the outside, but for TSW it feels like it's like, people describe it as a bone deep itch. So it's very deep and it's very, very intense. And pain, there's a lot of pain that we experience. People think it's in the nerves. It's because of the nerve damage that came from the topical steroids, but of course we don't know for sure. That's just our theory right now. So we also experience a lot of, like, it feels like a lot of pins, like constantly like sticking into the skin. So we have pain like that, and then we have tingling sensations. You know, I used to feel like there were like insects crawling on my skin at times when I'm trying to go to bed. I just feel like something on my skin, but it's either the blood vessels or the nerves. So these tingling sensations. We often have recurring skin infections. I've heard like bacterial, fungal, and viral even. So when the skin acts like a barrier, so like a protective barrier, and when it's compromised, the bacteria or these microorganisms often take the chance to infect the skin when it's compromised. So that's why even if you eradicate it, even if you take antibiotics, antifungals, you take these things, they often come back right afterwards. And this is from like, I've dealt with this like so many times, but I've also read so many other people sharing the exact same story. You know, they go to the doctor, they get these a lot. Usually it's antibiotics, but take antibiotics for a week, and it's good during that week. But once that's over, it comes back, and oftentimes it's even worse. Like the flare is even worse, and the theory is that because the antibiotics also wipe out the beneficial microorganisms that usually make it harder for your skin to get infected, you're also wiping those out. So it just gets worse and worse. And you have pus-filled bumps and hair loss. A lot of people, including myself, we lose our hair falls out, our eyebrows fall out, our eyelashes fall out. So it's quite common. And most people report that it grows back out afterwards, but I've also seen some people who suffer from TSW for a long time. They're looking for ways to grow back their hair, but I guess it doesn't grow back so quickly or so easily. And we often have like secondary symptoms, and we have insomnia a lot of times, and if you're itching and you're in pain all the time, it feels like it's going crazy. It makes sense that you can't sleep, especially like when it goes to your back, to your neck, to your scalp, and you're trying to lay down. It's just very, very uncomfortable. And people with TSW often just have sleepless nights. And there's also other issues like your adrenals are messed up, and that makes it even harder to sleep. I've spent like weeks, months just laying in bed all the way until morning, like 7 or 8 in the morning, and then I finally fall asleep for a few hours. And then this happens every single day. There's no breaks, and for weeks on end. I've had so many stretches like that. So insomnia is definitely a side effect. And the issue with a lot of these symptoms is that when you just look at it in like without too much detail, in just a very short amount of time, it looks like eczema. It looks, because it's inflammation in the skin, right? That's what eczema is. Your skin is inflamed. So it looks like a really bad case of eczema. So that's why it's really difficult for us when we go to a doctor. They're not going to know anything about TSW. They're not, even if they feel like it exists, they don't know about it in detail, and they're not going to diagnose you with that. And even if they do, what can they do, right? Their only tools are antibiotics, immunosuppressants, steroids. And these are the things that make us take longer to heal from TSW, actually, in general case. So there's also some other symptoms. A lot of times we feel really cold. We lose the ability to control our body's temperature. So people like I've also experienced this many times, like even in a warm environment, I'm like shivering cold, even with a hoodie on and it's like sunny outside. It's just usually when my skin is doing really bad, I have this issue, and it's also shared by a lot of other sufferers, so it's quite common. And we also have out of control vasodilation, so our blood vessels, okay, I'm going to talk about this a little bit more later, but the blood vessels are, when you use topical steroids, it forces the blood vessels to constrict, to stay, like, not expand basically, because when it expands, that's when you have your rashes. So it gets rid of the rashes partly by constricting the blood vessels. And after a while, the blood vessels, they kind of, they're trying to expand and you're constricting it. So it'll rebound, it'll expand in an out of control fashion. And especially once you stop steroids, it'll expand really easily and very drastically. So you have the rashes, and it goes to a point where it expands so much that the blood vessels, they have tears in the blood vessels, and it becomes leaky. So the liquids inside the blood vessels, they leak out of the blood vessels into the other tissue in your skin, and that causes an inflammatory response. So you get more inflammation. So as a result, a lot of TSW sufferers also struggle with things like hot foods, hot weather. Some people suffer with the sun, and also foods that are high in arginine but low in lysine. So all of these things are things that would cause vasodilation. It would usually be considered healthy in like a normal person, but in people who have TSW, it just causes like flares, big flares. And like what I explained with the blood vessels, leakage, more inflammation. So I would avoid these things. And of course there are secondary effects like fatigue. You're kind of like in this fight or flight response all the time, and you have like, you're constantly scratching and there's like flakes everywhere. You're trying to clean up, and once you clean it, you're itchy again, so you scratch again. So I've had times where I spend like 3 hours straight just doing this cycle of scratching and cleaning and scratching and cleaning. After a while, it is extremely frustrating. It's very tiring. And emotional issues, of course. And the last symptom is cycles. So a lot of people feel like it's this endless cycle of the skin becoming thicker, like flaring, basically thicker and hard, and then the inflammation will die down, and the thick skin turns into flakes, and they flake off everywhere. And then for a short while, once it's all flaked off, they'll feel like, oh, my skin like is in like a pretty good condition compared to like the worst TSW condition. It's like acceptable. And then it goes back to like the next flare, and it cycles and cycles like that. So I've read hundreds of cases of how people go from having just a slight skin issue all the way to realizing that they have TSW. And I've also talked to a lot of TSW sufferers throughout these years, and most of the time when they explain their experiences from the beginning, it's usually very similar. So here, I'll share a general case of how it usually goes. So it starts out with a minor issue. Sometimes it's just a bug bite. Sometimes it's a skin reaction to a food or a cosmetic product. Sometimes it's mild eczema, maybe a rash on a small area such as the eyelid. And That's also what I experienced. And some people start from childhood eczema. Then the patient usually sees a dermatologist in hopes of getting it resolved. We are then prescribed topical steroids and we're told that it's safe as long as we follow their instructions. They usually say something like, use pulse therapy, use the steroids for a few days and then stop, and then repeat as the rashes come back up again. And usually it works very well in the beginning. The rashes are gone for a while, but over time we get worsening issues. We end up having to use the steroids more and more often, and sometimes we go back to the doctor and they give us stronger steroids to try to fix our worsening condition. We go into this cycle of stronger and stronger steroids that work less and less effectively. There comes a point where the rashes start to spread. A lot of cases I've read start from a small area and it spreads to larger and larger areas, and a lot of times it ends up being full body. So mine was similar to this. Mine started from eyelid and then neck, and then it was like face, scalp, and then it was, you could see the rash go down like my arm, my chest, my back, all the way down to my ankles. When it gets extreme, the steroids barely even work anymore, and our skin becomes extremely sensitive to everything it comes into contact with. Like I said before, water, a breeze even, any type of lotion, any type of oil. It just burns, everything just starts to burn at some point. And we start developing these big wrinkles that we didn't have before, these big folds in our skin, and our skin is just burning red. At some point, people either realize that it's the topical steroids that's causing the worsening issues, or they try to do some research online and they see information related to TSW. For myself, it started in 2015, and back then there was very little information on TSW. So I spent hours and hours learning about different skin conditions, reading about people's anecdotal experiences and trying to match it with my condition, but none of it ever really matched up that well. So I saw doctor after doctor, none of them could even help me one bit, except for just try to give me more steroids, tell me to use such and such lotion. I told them everything burned, but they just keep pushing these creams as if it would help, and none of it did. And after around 1 year, I finally found people online who shared this very similar experiences, both timeline, how it looked, the symptoms, the areas of where I had it, and the red sleeves, the elephant skin, the weird facial flares, and they were TSW sufferers. So usually the TSW story is something similar to that. And one main difference though is that people seem to have different lengths of time in terms of how long they use topical steroids for. Some have used it for several months before developing symptoms, and some have used it for 10, 20 years, some all the way from childhood. So for the sufferers who had it since childhood, they spend decades thinking that they had eczema the entire time and they have to use these creams. And a lot of times from what I've read, after they go through TSW, they end up returning to normal, where they don't even have the eczema that they had as a child. So now I'm going to talk about the mechanism of this disease, just share our current understanding. And a big problem is that there isn't much interest in studying this because there just isn't much monetary incentive. These kind of investments usually go into creating new drugs and treatments that they can make a patent off of and then make a lot of money out of. So there just isn't much monetary incentive here. But the current theory is that the topical steroids, they lower collagen production. They also break down the collagen that's currently there, causing a thinned skin. The barrier is not working very well in that case, so it becomes much more susceptible to microbials such as bacteria, fungi, and these things cause more inflammation, and the constant inflammation also breaks down the skin barrier even more, so it's like a cycle. And another mechanism is that topical steroids, like I said before, it suppresses blood vessel dilation. So there usually causes a rebound. The out of control vasodilation that results from that causes the rashes, but also the leakage of the blood vessels, once again causing a cycle of more inflammation. And the chronic inflammation causes damage to the skin, so it's like a cycle of more and more damage, weeping, red sleeves, and so on. Like I said before, there are things like high arginine foods such as chocolate, most types of nuts, and collagen. These things, as well as hot weather, spicy foods, and some types of therapy such as red light therapy causes more vasodilation. So for a lot of people, these things cause more rashes, and I would try to avoid them. And then another thing it does, like I said before, are the damaged nerves, which cause pain, like the tingling sensations, the needles, and the steroids can damage nerves. This is very well documented in a lot of medical literature, but for some reason, your dermatologist won't really consider this possibility. And then there are other issues I would think are less serious issues, such as the steroids might cause your body's cortisol function to go out of whack in a short term. The constant inflammation might cause other issues such as adrenal function issues. And I think these are less important. These are like secondary effects from all the discussions I've read, from all of my own experiences and understanding. I believe that the physical effects that your topical steroids had directly on the skin, so the outer issues are the most important ones. They're the most severe ones that amplify everything else that happens internally in the body. So you'll hear a lot of people talking about trying to fix their TSW by healing the gut, probiotics, a lot of improving liver function. A lot of these things, they might help, but like I said, it's the external damage that's amplifying all the reactiveness, the inflammation, that all these like internal things, the issues that they cause are amplified because of how damaged the skin is. So I think the internal things are mostly secondary, apart from avoiding inflammatory foods. That can have a big effect. But even then, even if you fix all these internal things, as long as the skin is still in that condition, you're going to have difficult issues. So that's it for this video. Just wanted to tell you guys in depth about what TSW is and how we think it works. And I know I didn't talk about treatments in this one, but I have so much to share. I want to keep it as organized as possible. So I'm going to make a video about where I talk about treatments in depth. Okay, so please hold on. And the most useful thing you can do right now is to join a bunch of Facebook groups that talk about topical steroid withdrawal. That's where you can ask questions directly, and even though a lot of the information there isn't so great, there's enough experience where people kind of have a consensus of the general things, the general understandings of how to deal with TSW. But please just note that TSW is not a straightforward thing to deal with. A lot of things are completely the opposite of your common sense. So when you're in these groups, beware of people who are newer into dealing with this, because their ideas of what helps and what doesn't usually changes as they get more into it. So once again, my name is Michael. I hope this video helps some people out there. If you're suffering from TSW, stay strong, and I'll be putting out more information soon. Thank you.